This is Mike.
And Christina.
And I don't want to brag or anything, but I'm known as the caretaker.
And I'm the blind chick living.
And we also come with the dumb dog.
Moosey boy.
Yep, and Moose, the Pomsky service dog, is Christina's service dog.
Baby.
And this is the Blind Chick Living podcast. Disclaimer.
We are not doctors. Please do not take any medical advice from us. What works for me might not work for you. Talk to your team.
Yeah, and if you've ever met me, you should really not take my advice unless you talk to your team.
Correct.
So, talk to your team. This is just our opinion. If you don't like it, then tell me yours. Alright, this is Mike.
And Christina.
And this is the Blind Chick Living monthly podcast. It is the January 2024 episode.
Yep.
And what we'll do is we'll just kind of recap all the random crap that's happened to Christina and dialysis stuff that we've learned about. And so, yeah.
Here we
you
go.
Ready?
Yep, let's do it.
All right, so first we're going to talk about prescriptions. And real quick, if you hear that buzzing in the background, that's not Christina being annoying, just going, No, it's the machine. She's doing dialysis right now, so if we get alarms, we'll deal with it. But, yeah, so, yeah?
Yeah.
Yeah, okay. All right, so we're going to talk about prescriptions. All right, anybody that has numerous prescriptions is going to totally understand what I'm talking about, especially if you deal with government insurance or you have two insurances. So if you're on dialysis for 30 months, Medicare or your government insurance or Medicaid becomes primary. It automatically does. It happens automatically, and your primary insurance becomes secondary. Now, a whole bunch of people are going to say, whoa, primary cannot be secondary. Yes, it can. And I have to explain this to doctors, pharmacists, the insurances, everybody. So, when you're dealing with lots of medicines, okay, we've been dealing with the medicine since about December 15th. I have OCD, so I have alarms that go off that say, hey, you need to put this prescription in, you have to put this prescription in. Some aren't covered by our mail-in pharmacy with Medicare, so I have to deal with Walgreens. Walgreens' computer system has a stroke every single time we show up because of the primary insurance thing. So I go back and forth every single time, every 90 days pretty much, with Walgreens or whatever pharmacist we're dealing with, and it all has to do with the secondary insurance, primary insurance, which one's supposed to pay. And Walgreens pretty much knows me. When I get in line, I think people duck out because it's just something that we're gonna have to deal with, and it's confusing because every 90 days we do this. Well, anyways, so we have a huge cost on this prescription that if it's done correct, it's free. And every time they fill it, it ends up being a god-awful amount in the hundreds, and I have to go and say, no, our primary is secondary, Medicare is primary, and usually it gets taken care of within a couple of days. So the computer system's going back and forth, and I come to find out that it's because Christina doesn't have the prior authorization. Now, this is a prescription she's been taking for, years?
Yeah.
And luckily, this isn't a life-saving medicine, but I am calling insurances, asking why I can't get the prior authorization. Both insurances are they're saying, no, it's not us, it's this one. I finally find out that it's my primary insurance, and they need a prior authorization. And, of course, I ask them, well, it's idiotic that the damn prescription that the doctor writes isn't the prior authorization. So you have to get a prior authorization to make sure that they wrote the prescription for the prescription they wrote. Yeah, it's stupid. And this is just crap that we deal with all the time. And that's Christina's alarm to actually take medicine. So, anyways, so that's another tangent that we can go on about for hours, about prior authorization and documents and all that stupid stuff. But, so I have my primary insurance fax the information to her doctor to get prior authorization. About a week goes by, we still have no prescription. It's sitting at the pharmacist, but they can't give it to us. So I call Christina's doctor and say, hey, I need this prior authorization done. She says, okay, I'll get on it. Week goes by, still don't have it. I call Walgreens, they say we still need prior authorization. Again, prior authorization, it's idiotic, but anyways. So then I call the doctor's office, and the only way you can get through to the doctor is if you leave a message. But it was getting to the point where we were running out of this medicine, so I was calling to make an appointment, and when you make an appointment, you actually get somebody on the line. So I would explain to the lady, I'm not here to make an appointment, and I need to talk to this lady about a prescription, so she transferred me, and we play that game for a couple days. Till finally I begged the lady, listen, just please go talk to her, I need the prior authorization. And the other lady is almost getting mad because she's like, I've done it. I'm like, okay, well, they don't have it, so do it again. So she does it again. Another 2 weeks pass, and I am calling the doctor's office again. I'm calling Walgreens, and all to find out that this lady was putting in the prescription for the wrong insurance, which, why that should effing matter, but because a prior authorization should be a prior authorization, but for some reason, one insurance will have to get a prior authorization, and then another couple months, another insurance will have to get prior authorization. So, finally we get it figured out, but we put a post on the Facebook group, and I go on a huge tangent about all of this crap. I do every 90 days, but I hope the people that we worked with through insurance and the doctor's office realizes that this could actually kill people, you know, and it's a joke, but it's not really a joke. But when someone has to deal with insurance, you understand why they just pretty much go home and die, because they make it almost impossible. And I've seen it firsthand, especially with Christina, with her limited sight. I can see how quick she can get frustrated and just, oh well, you know. You have anything?
No, I agree.
Yeah, it's idiotic. So, everybody, complain to your insurances, complain to everybody, because the only way that we're going to get stuff to change is if we start talking about it. But we need to hold these doctor offices accountable. We need to hold insurances accountable. We need to hold pharmacists accountable, the pharmacies accountable, because all of this got held up by one person, and she was doing the job she thought she was supposed to be doing, but she was doing it wrong. And nobody was following up with her. They were just saying, oh, we're not getting it. And I would call my insurance and be like, hey, can you call this doctor's office? Because she says she's done it. Oh, I'm not allowed to do that, sir. I'm like, you're talking to me right now. You can't just pick up your cell phone and call these people? You know, so it's stupid. So, yeah. All right. Well, that was a tangent for a minute, but prescriptions. Fix your damn problems. So, let's see. Do you want to talk about your devastating news?
Devastating news.
Devastating news.
Oh, no.
Tyler moved out.
Well, yeah, it is pretty devastating.
Yeah, it is devastating.
My baby officially moved out.
You kicked her out?
No, I
Oh.
didn't kick her out. Silly. And the funny thing, well, it's not funny at all, but 2 days before she was supposed to move out, she went to the trampoline park and busted her knee.
Her boyfriend broke her damn knee.
They were on a date, and so Mike keeps telling him that it was his fault.
Yeah.
Yeah.
So, do you want to tell him where she moved out to? And
Yeah, so she moved out to the dorms at her college, and it was actually pretty cool. I got to help her kind of put everything together, organize everything, and then go home without her.
Yep. And she is going to Weber State University. She's living in the dorms. And I'll just say this, that she packs like an idiot. So,
yes, she does.
Yeah. We have been telling her to pack for like 3 months. She's been saying every single time, I have. Well, on the day we moved, we realized real quick that she didn't. And what she did was not even stuff she needed. So, yeah.
And on a different note, I'm a super duper duper proud mama. She's going to college. She's getting a grade. She's doing so phenomenal. And with her breaking her knee, she's been on crutches the entire semester, out in the snow and in the cold, and she has been doing it. She's made to every single class, and she had surgery yesterday, and now it's repaired.
So
and
what all did they have to do?
So it's usually when you break it the way she did, the ACL gets torn. Well, for some reason her body, the ACL stayed, but it pulled a chunk of bone off. So it was completely unattached to the knee, and the bone was just off in the distance, I guess. But so they had to go in and pull down the ACL and reattach that with screws. And they did it, and now she is home for the weekend, and Mom's taking care of her.
Yep. And I will let you know, too, that every time she's been on her crutches and she's been struggling, I have made sure that I've grabbed a snowball and hucked it at her head. And it's hit a couple times. So that's a plus.
Oh, my gosh.
All right. Let's see. I actually did want to mention something, too, that we had a baby shower this month.
We did. Oh, my gosh.
For who?
For Sadie.
Yeah.
And it went amazing. And we're so excited because we're getting super close now.
It is. And I will say that when the planning was happening, Christina decided to have heart surgery. So I had to talk to my ex-wife.
Yes, he did.
And oh my God.
He didn't like that too much.
No, I did not. And I planned a good portion of the baby shower. And it was a pain in the butt. And I don't ever want to plan a baby shower ever again. But it went amazing.
It did. It was great.
You want to tell them the game you did?
Oh, I did the whole candy bars in the diapers. And me and Tyler went through and put candy bars in the diapers, melted them all, and we gave samples of the candy bars, and it was really, really fun.
And these diapers were so tiny.
They were newborn.
I forgot.
They were so small.
I forgot how small little preemie and newborn babies are. And it's gonna be so much fun.
Oh my gosh! So I'm not too excited for the newborn phase. I am a toddler chick, so once she turns 2, I'll be her best friend.
I am and pay attention on Facebook, because I already told Sadie that I'm gonna send her a picture with me and the baby doing some random Photoshop thing, like, I don't know, mountain climbing, or I'm dangling her off a hook and fishing, or bungee jumping, or it's gonna be fun, because I already warned her that we're gonna be doing that every day. Also, do you want to tell them about the dialysis case that we're making and the progress that you've made?
Oh, so I haven't. That's all on you.
What?
I did not do anything to help.
Oh, okay. Well, anyways, I have been experimenting with dialysis cases. I went through about 4 of them, and they've all been somewhat successful. My last one was really successful, but keeping it closed was kind of an issue. It wasn't, but I was worried that it was going to pop open. So I have a brand new case. So be watching when we go to the National Kidney Foundation to Washington, D.C. and watch this thing tumble down the luggage carriage.
Oh my gosh.
Yeah.
That's going to be crazy.
It's going to be cool, but it's really awesome. I got a Pelican case. There's a guy named Michael Johnson on our group, and he figured it out before me. Damn you, Michael. But it is a Pelican 0350. I picked one up actually extremely cheap on eBay and got the foam. They shipped the machine in and cut that down, fit it in the box, and Christina just thinks it's freaking awesome and sexy, right?
I am so excited about it, and you look like even extra manly now that it's done.
Yeah, I do. It has big giant handles yeah. And I'm going to be putting stickers on it again and bedazzling it, but manually bedazzling.
Yeah.
With a couple chick stickers on there too. Alright, so that's that. And that's pretty much the month. We're also going to talk about, I have actually started doing something, and who knows if anything will come of it, but I have decided that I am going to write a book.
Yeah.
It is going to be basically the care partner story, but it's basically going to be my background story and then a lot of the dialysis and care partnering and stuff like that we've had to deal with and what I've learned throughout the process, starting the group and just stuff like that. And it's actually going amazing. Who knows if it's amazing or not? It probably just sounds like babble. But I'm up to like 52 pages now.
Yeah.
And I've only gotten through winning custody of Sadie. So it hasn't really even started the care partnering other than my sister Rebecca. But so yeah, be on the lookout for that or something. I don't know.
I got one more.
Okay, what is that?
All right. So I've been going through this kidney journey for a very, very long time, and I finally got diagnosed. So we found out that.
Whoa! Hold on.
Okay.
I found some sound effects, so I'm going to be throwing sound effects in here and there. So that was a perfect time for one.
All right.
Okay, go ahead.
Okay, good to know. Yeah, so I got diagnosed, and I do happen to have C3 globular nephritis. But I have an interesting version of C3. Normally, kind of C3, what it is there is a mutation in your proteins. And so normally, if you have that, then you can get plasmapheresis because your proteins are in your plasma. And so basically that goes through your kidneys and it kills your kidneys over time. And so normally you can get plasmapheresis. It takes out all your plasma and gives you all fresh new plasma, and that makes it to where your body can't kill off that kidney. Well, for me, mine is not in my proteins. They have no idea where it is.
So what you're saying is you're 1 in a million?
Well, so far, I'm the only one ever that has had this.
Yeah, it's not 1 in a million. It's 1 in 340 million. Christina, there has never been a case like this before, right?
Never.
Yeah. So,
and they were even saying, like, so I had to get the genetic testing to find this out. And the genetic testing center was telling me that I'm going to be contacted by, like, a big group of doctors. And I'm going to be asked, like, tons of questions. And they're actually going to put it on their list. So it will be added to the disease file that they compare all of the new people to.
And this is really cool because by doing stuff like this, if anyone comes up with a case that's close to hers, they can refer to these studies that they're doing with Christina right now, and hopefully everything that they decide works.
Yeah.
So they can reference this to other people. Do you want to tell them about the medicine and the insurance?
Yeah, so apparently the doctors think that there's one medication that could help me. It's never been used for something like this, but apparently it is crazy expensive, and most insurances deny it. And so we were kind of like hoping that maybe there might be a chance it would go through if we appealed it a few times, but we got approved right away.
Which takes us into our next subject, which Christina is back on the kidney transplant list.
I am.
And which really messes up the crap that I was doing. But I was trying to get matched to Christina. I was shown that I wasn't a match, and during this time, we didn't know what her disease was.
Yeah.
They told us that there would be absolutely no way that this medicine would be approved. It's probably going to take a ton of time. And so I decide with Christina that I am going to go ahead and get matched to somebody else.
Yep.
And we even told each other, hey, this is a long shot, but I'm going to get tested. What do you think? She was totally on board. And so on the day that I found out that Christina's medicine got approved, I was also informed that I am a match to this person. Which I mean, that's great news, but at the same time, I'm also being told that my wife is back on the transplant list. And
so we could do the para exchange program, or he could donate to this person.
But the thing is that if I donate to this person, Christina doesn't get my voucher for here's a +1 kidney that gives you more of a chance at getting a kidney.
Well, it puts you in a different pool. So
yeah. So, we've had to kind of deal with that, and we have made the decision as of right now, and that might change tomorrow. But I have decided I'm going to go ahead and keep trying to qualify to donate a kidney, and
to this other person.
And so that causes a whole bunch of other backstories of trying to start some conversations on updating the policy list on how to donate and stuff like that. Because what if you do, my main thing right now is, what if you do have multiple people that you care about that need a kidney? Do you just pick a name out of that hat? Do you flip a coin? Do you, like, for example, if Christina needed a kidney and so did my daughter, how do you make that choice? So, and it's difficult, but I all I want is the conversation to get started again, because we're relying on policies that were started in the early 90s, and there's new ways of doing things, there's different ways, so that's it. Yeah. So, anything else on that?
No.
So, I am dieting and working out a ton to lose the pesky pounds. To get down to a qualifying weight, which I think is stupid too, because, I want to be the healthiest I can for transplant or to donate a kidney, but I'm also, at least I feel, probably one of the most active people that I've met, or that, but yet my BMI is high. But I'm a thick guy. So even at my healthiest, I'm still just a thick guy. But yeah, anyways. Anything else about how awesome I am?
Nope.
Really?
Yep.
Huh. Okay. All right. So we have some questions from people on the group, and so I'm gonna go over those, and then you can kind of just give us your answer of what you think. Okay. All right. So this is from, and I'm gonna beat up all of the names, but Yali Cuevas.
Okay.
Disability. She wants to kind of know about some traveling tips and experiences, all types, in-center, PD, HHD. Do you want to kind of explain how you would travel with that stuff?
So, like, honestly, I think traveling is hardest when you're in center. Because I think for me, I don't want to rely on another center to make sure that chair's available for me. And that's because I did go on a trip once and I did get turned away from the center that I had an appointment at. And it ruined the whole trip. And so I just don't...
That was for a wedding, right?
Yes, I missed my sister's wedding because I had to do dialysis the day she was getting married instead of the day before. And so, yeah, I don't rely on that anymore. But PD is, I think, by far the easiest thing to travel with. And that's because it has, like, no weight to it. You just get in carry-on luggage and go do your thing,
And that's even if you take your machine. With PD, you can do manuals, too.
Yeah.
So
true.
We traveled absolutely everywhere with PD. It was amazing. It was carry-on. Again, all supplies can show up wherever we're going. And again, those can be manuals, so you don't even have to take your machine. But if you do, it's a carry-on luggage. So,
yeah.
You want to tell them about traveling with HHD?
Yeah, so with HHD, I think the more you do it, the better you get. And I think there's certain little keys that we found out that we do now every time that are important, like the list. We have a list of every single thing.
Yeah, and if you ever go on my group, Living on Dialysis, or just hashtag Blind Chick Living, you can find this list. And what I've done is I've actually made it a list of where I put it on the counter, and then I check off the list as I'm putting it in the bag. And it's really important that you don't get in the routine of, oh, I did this, or I did this.
Because you forget stuff.
You will forget stuff. And so plan on forgetting stuff. And so kind of like where I pack my burritos, the stuff we use for starting treatment and ending treatment, I assume that I forgot to pack those. So I always have a bag of backup supplies for the what if. And then packing saline opposed to having it show up where you're going. Now, if you know you're going to a place, which not many people are going to do, but if you know you're going to a place where there's going to be dialysis happening, then meet up with a bunch of them and say, hey, I'm having these cassettes delivered, or I'm having a box of saline. I'm going to accidentally, because they're prescriptions, but I'm going to accidentally leave some outside my door. And if people happen to pick them up, then they don't have to pack those themselves. So we kind of just had one person order some saline, and we were able to disperse that throughout a couple people. But yeah, just make sure you're checking off your list and make sure you're planning that you are going to mess up and need extra supplies.
And I think what's really important is to verify before you even get on the plane that your supplies are there. And we learned, we actually have them take photos of the supplies now, because we've been told, oh yeah, they're here, and then you get there and they don't know anything about them.
Yep, get a photo, see if they can email it to you, and get a name of the person that you're talking to. Also, ask that hotel if they
charge
for deliveries, which we did not one time. And dialysis packages weigh about 20 pounds. So each box cost us $25.
Yep.
And we had, 18 delivered or something like that?
Yep.
So, yeah, that was a quick lesson of making sure that you find out if the hotel charges for delivery.
Yeah.
And we're going to be trying a new thing, and in Vegas, we'll update you on that. But we can arrange for the delivery company to deliver it the day we get there, which is kind of scary too, because when you go, you want to make sure your supplies are there already.
Yep.
So we're going to play around with this one a little bit. I know some people in Vegas, and I might have it delivered to their house. We haven't decided yet.
Yeah.
So update on that, but we'll let you know. But yeah, always make sure that you check to see if there's a delivery charge, and then always have them email you a picture and find out the name of who you talk to. Because when you get up to the office, they do not care about your packages, and they will say, "Oh well, we don't know where this is. We'll let you know on Monday," and that's a Friday night, which does not work with us. So.
Yeah, and I also think something really important is give yourself an extra hour at the airport. So don't show up 2 hours before, show up at least 3 hours. Just because getting that machine checked in every time you're going to get a new person, and you are not guaranteed that they know what they're doing.
Yep, and take the travel paperwork from the ADA. And when they try to charge you for your medical, you tell them they're not allowed to, and you have a copy of that. If you need to, message me on Facebook or Blind Chick Living or whatever, and I can give you all of that documentation. I've even laminated it, and it is actually on one of our carry-on bags, because we have to have special paperwork for Moose also.
Yeah.
So I always have that. I always have the national, whatever the airport ADA paperwork is, and the doctor's note saying that she needs the medical, and something else. So make sure you have all of that stuff, and like Christina said, always plan that you're going to have problems.
Yep.
So we always plan on that we're going to have coffee and donuts or breakfast at the airport, and it's expensive, but it's because we always plan that something's going to go wrong.
Yep.
And if it doesn't, cool. We just sit back and make out or
eat?
Oh yeah, okay. I guess we just eat. So all right, so that's traveling with dialysis.
Okay.
And always give yourself extra time. I try to give myself at least a month and a half of time for them to put the order in for delivering and stuff like that. I think that's it.
Yeah.
All right. Okay, this next question. Where to file a complaint about equipment failure, especially multiple failures? Do you have any advice on that?
How to file one?
Yeah.
I don't.
Okay, so I'll tell you, whatever dialysis machine you're using, there's going to be a customer service number. Call and log it. Call and log every problem that you have, and they will be able to help you. I will say Next Stage in particular.
Yeah, we've had them help us every time. We
have absolutely no problems with Next Stage. We can call customer service and usually get something overnighted to us. And I know the lady, Gail Potter, and it gets easier, I promise. At the very beginning of dialysis, PD, HHD, you are going to have a ton of alarms. You're going to have a ton of needle problems. Just don't give up, because it gets better. We've been doing dialysis this entire time, and we have not had one alarm. And I can honestly say, I can't remember the last time we had an alarm where it was huge.
Didn't know what to do.
Yeah, it is usually seconds where we'll wake up, take an early alarm, and we're back to bed within 5 minutes. So, don't give up. It gets easier, I promise. Okay, another one that Gail Pardo asked is why treatments are not codified so much different between clinics. So what she's saying is, why are they all different? Why, if I go to a Fresenius clinic, it's this way. If I go to a US Renal, it's this way. If I go to a DaVita, and I've actually noticed it has nothing to do with the clinic that you're at. It's actually the individual clinic, because those can vary from each clinic. From a US Renal or a Fresenius, the same Fresenius a block away, you're going to find that it's totally different.
Yeah. And it's just because there's nothing actually regulating that.
And honestly, that's why I started the group, because I was finding so many differences that I wasn't sure which one to follow. It's kind of like doing labs on Christina every month. If you ask every single person that does labs, each one does it a different way.
Yep.
From just before you spin your blood. There's some people that they hold their blood for 30 minutes and then spin it.
Huh.
Yeah, I know. I spin it right away, which I know a whole bunch of people are probably gasping right now because they're being told you need to wait half an hour, you need to wait an hour. And there's some people that are told not to put it in the fridge for 3 hours.
Oh, wow.
I know. So, just get with your clinic. They should have some paperwork on how to do it. If they don't, ask them for some paperwork so that you can rely back on that. Because every single clinic's going to be different. And hopefully we'll be able to iron up some of those differences. Because there is new training that's in the process of starting to come out. And that was one of our biggest complaints is, listen, if we're doing training, Joe Blow across the street is doing it totally different than us. And we need to kind of iron that up so that, if God forbid something happened, Christina could call anyone in and, well, I don't even know what I'm saying on that, but Christina could go to any clinic and they would know exactly how she's doing treatment because it's not going to be different. And it's, so yeah, it's, it's in the works, but
we'll
just
see.
Follow what your team says. And if you don't agree with your team, ask the questions. So, all right. Shameka Aisborne.
Yay!
Okay. She wants to know, seriously, do you ever feel like you need a day off, decompress mentally from dialysis? Like, just skip a treatment, and what do you do?
Yeah, I feel that way all the time. I remember with PD feeling that so often because it's an everyday thing. But I think I honestly just have to tell myself, hey, if you skip this, tomorrow's going to be even worse. And this is just part of my life. And I just don't give myself a choice anymore. It's something I do, and I deal with it. With chemo, I have had a little more leeway to the point where we could skip one extra day, and I feel good enough to do that. And so PD gives me more flexibility there. And so, yeah.
You mean HHD gives you more flexibility?
Oh, yeah. Oops.
So, and I'll say basically, too, that if you feel this way, you usually feel this way a day and a half beforehand. Or kind of like where Tyler just had surgery on her knee. She had surgery on her knee on Friday. We usually do treatment on Friday. Okay, there was no way I was going to be able to get Christina away from Tyler to do treatment that day. And we already knew that was going to happen, so we actually did treatment on Thursday. And there has been, there's been a handful of times where, Christina does treatment pretty much every other day.
Yeah.
And there's days where I just don't want to do it.
Yeah, it's
and
true.
same with
been
Christina.
Days where you don't feel well, and so we will do the weekend type thing, and we will go the 2.5 days. And I honestly I think because my body's gotten so much stronger on home hemo that I can do those days, and I don't feel the way I did when we did those days in center.
See, and I think too that you kind of mentally prep yourself that, okay, tomorrow I'm going to skip treatment. So right now I'm going to start conserving on my liquids.
Yes.
I'm going to start following the diet a little bit more because you know that potassium and phosphate is all going to build up. So you kind of prep yourself for that. So if you want a day off, there's absolutely no problem, Shameka. Take a day off.
Yeah.
But just plan for that day off. And if you need to, end the treatment early. Nobody says that you have to do an entire treatment. And, of course, follow up with your team. But there's been numerous times where Christina, so she does dialysis 7 hours at night. And there's times where she wakes up 5 hours in and she's like, I want to unhook.
Yeah.
And I actually kind of plan that Christina's going to unhook early. Now, she rarely does. But, like, with what we're pulling right now, we're pulling 1.9. And so 1.9 is supposed to be, like, 0.24 for the 7 hours. It's whole math, calculus, whatever. But, hey, you got to be really smart.
It's like addition and subtraction, baby.
Hey, it's hard.
Okay.
But, so I just kind of program the machine that the machine is going to be done pulling anything Christina has within 5 hours. Yeah. And then the rest of the treatment, if it has to continue, it's just pretty much cleaning her blood.
Yeah.
No issue. But if she wakes up and wants to disconnect or something happens with Tyler or something, then we can just disconnect and there's no harm because she already pulled all of her fluid. Yep. So we don't do it all the time, but it happens. So...
Okay. All
right. So back to the questions. All right. Shameka has another one. Okay. And so you can answer this one because I think you'll know. Maybe this hasn't been asked yet, but Mike, why are you so handsome and smart?
Oh my God. Shameka, you have been fooled.
What? Wait, what?
Fooled.
Well, when I put the post on there, I put, please stop asking why I'm so attractive and smart.
Oh my gosh.
It's getting old, but Shameka... It's because I'm freaking awesome and amazing.
I was going to say, maybe she just put that because you helped her pack her stuff once.
Yep. Helped her pack and helped her get to the airport. It was a lot of fun. She's awesome.
She is.
All right, so Kelly Cantrell asks, helping to get patients moving and more active. What's your suggestion on that?
Ooh. So, how to help them? So, I don't know. Because I think, like, for me, how I get up and moving is I tell myself over and over again that I'm going to heal quicker and better if I get up and move. And so in my head, I don't want to feel that way for a long period of time. I would rather deal with hurting while you're getting up and moving for 5 days than for 2 weeks because you didn't get up and move. So let them know, like, hey, if you get up and start moving, you're healing quicker and you're recovering quicker. So you're going to be in pain less overall.
Okay, and on mine, I'm going to basically say give them tiny goals to achieve. With Christina, especially when she was starting the dialysis and in-center and stuff like that, I would give her little tiny goals of, okay, just go up and down the stairs. Or walk out to the mailbox.
Yeah.
Because once you get that blood pumping and once you get that blood moving, it's amazing. And I would even point it out to Christina, but I would be like, it is a night and day difference of when I can see that you pushed yourself and got out of bed and walked the stairs or walked to the mailbox, just getting some vitamin D or getting that blood pumping. It is amazing the difference between one day and the next.
Yeah.
So push yourself to get out of bed and go walk around the counter 1 or 2 times.
Yeah.
Or go down the stairs, and what I tell Christina is go do all of the laundry.
Yeah, right.
Okay, yeah, that doesn't happen, but just go down the stairs and up them. And that's what I would tell Christina. I'm like, okay, it's lunchtime. You know, let's try to do that. And she even would realize, like, days and days later, that how much better she's starting to feel.
Oh, yeah.
So if you get them and give them little goals of, okay, go around the counter. Okay, now go down the stairs and back up. All right, now let's go for a walk in the park. You know, just little things to get a little bit... give them just little goals to achieve.
Get some extra oxygen.
Yep. And I'll also say, go home. Go do dialysis at home.
Yeah.
It's going to be a 9-day difference. If you're doing in-center, cool, whatever. But go home. All right, Judy Lennon, can you talk about blood pressure and when it's too high and too low?
So, I think it varies for everyone. I had been having very low blood pressures, and the blood pressures I was having for anyone else, they would have been passed out. And so everyone's going to be different on this, but I think if you start getting to the point where you're like over 140, over like 100, like multiple times, I would say, hey, bring that up to your doctor. Make an appointment, get in there, and don't let them say, oh, well, that's okay. It's not that bad.
Yeah, it's never okay.
It's not okay.
And on the care partner side or when you're running treatment side, if you notice that your blood pressure is always running high, have them look at your dry weight. It could be that they're not taking off enough.
Yeah.
Same thing is if you are tanking halfway through your treatment and it's a religious thing that 3 hours in or 2 hours in, you just start tanking, your dry weight may be too low. So low dry weight usually results in lower blood pressure. High liquid weight is usually high blood pressure. Now, that's not always going to be that way, but when we're running treatment, I will watch Christina's blood pressures throughout treatment, and as it's dropping, I know that she's kind of going down to her dry weight.
Yeah.
So talk to your team, and your team can keep you informed of what's okay and what's not. And we probably went way too long with our team saying, oh, that's fine.
Yeah.
Because her blood pressures were way too low. But we got that fixed, we got it addressed, and her blood pressures are still low, but she's
slowly going up.
Getting better. Yeah. All right, so we're almost out of time. So we're actually going to just talk about some transplants that have happened this month.
Oh, excellent.
And so I'll let you comment right after, but Ivan Castillo, okay, our little buddy, he got a kidney. I've known Ivan and his wife Joyce. We met them in Boston, and we've known them ever since the start of the group. And if you don't know Ivan, you need to go check out his page. He makes some extremely funny videos. Yeah. They're geeky as hell. They're Star Wars and stuff like that, but they're funny. Go check him out. Also, about his transplant, it was late at night, November 19th, 2023, and he says that I'm doing good, but recovery is slow. His advice for transplant is it's not guaranteed to work. Do all you can to give your kidney the best possible chance. And I mean that's walking, your diet. He was struggling there at the beginning, but he seems to be doing great. All right, another person that got a transplant is Angel Pitts. She says, I'm doing okay. I got a transplant on January 10th, 2024. Still having a little pain, and my one piece of advice is dialysis is rough, and it takes discipline, and so does transplant. I'm having trouble with nausea from all the meds, which they will decrease over time. Just stay positive throughout it, and just wait to eat and blah, blah. Yep. So, congrats to her. All right, and Gabi Morales. This one's cool. I told you about her at the group, and she was having she needed help cannulating like a year and a half ago, 2 years ago, where she wanted to convince her care partner to help and all that stuff, if you remember.
Yeah.
She was amazing. She, with the group, we've helped her throughout almost every step of the process. And she is one that don't give up, because it does get better. And she is she's a pure example of it, because it was, I can't cannulate. Can you help me? I can't do this. I can't shove on my needles. I mean, I sat down and I helped her step by step with her team, of course, but she was just thriving and doing amazing on dialysis, and then got her kidney. So that was great.
Awesome.
And what's cool is on January, she got a second kidney transplant on January 7th, 2024, which is weird because her first transplant was 25 years ago on the same date. January 7th, 1999. And that kidney lasted for 18 years. Gabi says, update as of now, I am about 3 weeks out and my creatine is 1.0. We're still adjusting my tax, so they suspect my new baseline will be 0.8 to 0.9.
Ooh.
Which is pretty normal person functioning.
Yeah.
I'm trying to walk at least a mile a day, so I'm not cooped up in the hotel. I've been pain-free since I left the hospital, so I haven't needed to take anything. No side effects of meds.
There we go.
For me, I'm actually on Celicept, again, like I was as a child. My number one advice for people who get transplanted is the more you move, the better. So you feel, so don't push yourself, but try to walk as much as you can.
So true.
I kind of want to say again, I just congratulate her through this entire process. She was one of those that when this happened, she had absolutely no idea what to do. I mean, it was a second transplant, so, I mean, she kind of knew, but...
I'm sure things are so different.
Oh, yeah.
From 25 years ago.
Absolutely. And so that is pretty much it, unless you just want to talk about whatever.
Well, I think that's freaking awesome. Congratulations, guys. You were all incredible, and... yeah, side effects, they do decrease. I was sick on the medications for a long time. It will get better. Just stick with it. And biggest thing, take your pills on time.
All right. And if you liked this podcast, please follow it, share it. What else?
Yeah. Have a good month. And we'll talk to you soon.
Yeah. So peace out.
Bye.